members are trying to join, and we'll get started and be on time and use this time and try to do our best to be as informative to the medical students. And what we're going to do is, I just want to thank everybody for joining, and I just want to tell you that this is very special for me, this session and this webinar, because my daughter is in medical school, and the reason it is everybody questions why your daughter. We're surprised that your daughter took medical school, because I work so crazy hard, and they're all surprised why is she not deterred by the hard work, why I still chose the same path. I'm excited and I'm happy to share, how the journey went through for me. I'm not very traditional mom. I'm chaotic, non-traditional, and just disorganized. So I can tell how I survived all these years, and I'm happy to share. I just wanted to go over just general rules, and what we're going to do. The format is we're going to introduce poll questions, and we answer all the concerns and the medical students will be having soon, and they're going to face during the practice, or when they're considering IC fellowship. And what I'm going to do is I'm the moderator, and we have Dr. Christine Chang as the co-moderator, and my name is Sri Devi Pita, and I'm intervention cardiologist, 13 years into practice. I have both community practice. I'm part of the medical student. I'm Texas Christian University and UNT. I'm involved in training of medical students and also residency program we have. And then I will let Dr. Chang to introduce herself.
Thank you. Yeah, thanks, Shri. So just thank you all for joining, and thank you to all the support from both ACC and SCAI. Alan Nguyen, who's on the call with us, has been really awesome in helping organize the logistics and helping this webinar run. Please feel free, as questions and comments come up, to enter them into the chat. Adriana Mares, who is one of our medical students, part of the ACC group, is here and will be moderating the questions as they come in. Any questions that don't get addressed during the course of the webinar, we'll all try to get to them by the end when there is some time dedicated to Q&A. I am a structural interventionalist. I trained on the East Coast in Boston and New York, and I'm currently based at the University of Washington in Seattle. This was my first faculty position out of training. I'm currently in my 4th year, doing both coronary, but now primarily structural procedures, and am involved with both SCAI and ACC. We'll now turn it over to our wonderful panel. We have a really broad cross-sectional representation across subspecialties within interventional, as well as regional representation, representation from different practice settings that will hopefully give you a broad view of the options for careers in this field. So Nalima, would you be willing to introduce yourself?
Yeah, sure. Hi, everyone. Thank you for giving me the opportunity to be the panelist. And I'm as excited as Sri is. My daughter is also willing to go into medical school. So that's exciting. Yeah, I'm a practicing interventional cardiologist. I've been in practice for 6 years now. I'm at Orlando, VA. VA is a different ball game. If you have any questions regarding the VA, how is the work-life balance and everything, I'm definitely happy to answer all the questions that you might have. I'm purely a coronary operator, and I do have 3 kids. So any questions pertaining to the kids and raising, I'm not a perfect mom either. None of us will feel that way, but there is no perfection. So that's all. I will pass it on to the next panelist.
Awesome. Thank you.
Thank you, Nilima. Hi, my name is Vaski Patel. I am a practicing interventional cardiologist here at Hartford Healthcare in Hartford, Connecticut. I was trained predominantly in Massachusetts. I did do a year of an echo fellowship at the VA as well. So Nilima, yes, the work-life balance is really, really stupendous at the VA. I am primarily interested in coronaries, particularly CHIP CTO, but I am just under 7 months into my attendingship. So I'm very fresh out of fellowship. So happy to answer questions about the transition, about what needs to be done for that. I was also someone who was not initially interested in cardiology. And then once I was interested in cardiology, I wasn't interested in interventional. So a lot of changes along the way. So anyone who is uncertain about the path, I would be happy to chip in and help.
Thank you. Thanks for being here.
Great. My name is June Lee. I'm an interventional cardiologist, endovascular specialist in University Hospitals in Cleveland. I actually grew up in Michigan, so go blue. Graduated in 2010, and I have been in Cleveland since then, completed all of my training here, stayed on as faculty about 5.5 years ago. I direct our vascular center along with our vascular surgeons and vascular medicine physicians, and also run the PERT program here.
Thank you.
I'm Deepthi Sudhakar. I am an interventional cardiologist, early career here in San Diego. I work in a private practice setting. I did my training in Orlando, Houston, and now I'm here in SoCal, so I kept it away from the snow for most of my career. My interest is complex coronary CTO. I'm excited to be here.
Yeah, I'm Poonam Velagapudi. I'm an interventional and structural cardiologist. I did my interventional training at Brown University, Rhode Island, and my structural at Columbia in New York. This is my old affiliation. I was at the University of Nebraska after my training for 5 years. And there I was the associate program director for cardiology and split my time between complex coronary and structural. And currently I'm on a break and I'll be joining my next job soon. But this is a great time to reflect upon self and family relations. So I'll be happy to answer questions with those regards. And my daughter is contemplating medicine. I just can't keep calm because I'm an interventional cardiologist.
It's just great to hear everybody's, just exciting. Looking forward to hear everybody's journey. Right. Adriana, you want to take over?
Thank you, Dr. Pita. And I just want to echo how special this webinar is for me and my colleagues here with leadership and all of our members with the ACC Med student community. This marks again our second webinar that we got to collaborate with SCAI, and we're just so proud of this collaboration. And this would not be possible without the support of Dr. Serene and Dr. Sudhakar, whom I initially met, and they expressed interest in supporting us in this effort, and just very thankful for today's panelists, whom we very much look up to, Dr. Pita, Dr. Patel, Dr. Lee, Dr. Velagapudi, Dr. Chung, Dr. Katakuri. Thank you very much for your time. We know how busy your schedules are, so we really appreciate this discussion. I'm Adriana Maris. I'm a ACC Med student leadership member. I'm at Yale School of Medicine, and I'm joined by a spectacular team of colleagues whom I'm very proud to have them join me in this webinar. So I'll turn it to Lena.
Hi everyone, I'm Ninaya. So I'm currently a student at University of Georgia and a member of the ACC Med student. I will pass it on to Lucy.
Hello, my name's Lucia Schroeder. I attend the Idaho College of Osteopathic Medicine. I'm a fourth-year medical student, and I am a part of the leadership group as well. I will pass it on to Mariana.
Hi everyone, I'm Mariana. I'm a fourth-year medical student at Dartmouth School of Medicine, and I'm the current co-chair with Tasha, who I'll pass it along to.
Hi, I'm Tasha Phillips-Wilson, recent medical graduate, St. George's University School of Medicine. I'm currently doing a Master in Public Health and Population Health Science at University of Michigan, go blue, and I'm the current co-chair of ACC Med Students. I'll pass it to Meghana.
Hi, I'm Meghana Iyer. I'm currently a third-year med student at Cleveland Clinic Lerner College of Medicine, so just down the street from UH, Dr. Lee. It's very nice to be here, and thank you all so much. And I'll pass it back to Adriana. Oh, you're muted.
Thank you, Meghana. And so first off, I know many of you all are curious on who we are and what type of community we have built over the past years. We founded this ACC Med student community, also known as MSMC, in 2020. We are composed of 15 leadership members. We serve over 500 medical students worldwide from over 60 different countries. And these are some of the pictures that we have taken the past ACC scientific sessions in person with, again, many of our med student members. Next slide, please. Our ACC MSMC focuses on 3 main projects. First off, student-focused resources, one of them being CVRI, also known as our Cardiovascular Research Initiative, Journal Club, editorial pieces, and cardiology-focused webinars such as these and podcasts. We also focus on networking opportunities, such as those in which we could hold on platforms like Doc Matter, Cardio Twitter, LinkedIn. We have also launched an initiative called the Cardiology Interest Groups, and we are actively involved in national and state chapter conferences throughout the ACC. Lastly, we focus on fostering professional development opportunities within our members, and that within that we focus on providing our own members leadership opportunities for them to grow as leaders in the field. We provide them mentorship through the research opportunities, for example, on CVRI, and we also hold cardiology panels, and we spotlight a lot of these members who are doing amazing work in their own institutions and communities. Next slide, please. So these are some of the articles that I want to spotlight that a lot of our members have been able to participate with us. So you see here our number of citations and the number of articles that we have published over the years. For us, we are very proud of this initiative only being a 4-year group. We have already published 15 articles and brought together so many students who from different countries who would not have the opportunity to collaborate with each other if it wouldn't be through this initiative. So we have published, as you can see in this slide, with Jack. Next slide, please. Also other articles in Jack, also either through original or abstract pieces, also on peer-reviewed journals such as Current Problems in Cardiology, etc. Next slide. And all of these articles vary depending on our mentors' expertise, and that's the mentorship that I was previously talking about. Next slide, please. And with that, I'll pass it on to Meghana, who will talk to us about our journal club.
Yes, thank you, Adriana. So one of our proudest initiatives and has been ongoing for 2 years now, and hopefully many more years to come, is our monthly journal club. These are hosted by students, moderated by students, and we're also very fortunate to have mentors who join us, as well as the principal investigators and clinical trialists who are able to join and discuss the trials that have been published, and there are always incredible discussions, incredible participation from medical students. Next slide, please. And in addition to the journal clubs, we also host webinars such as this one in collaboration with SCAI. As we have mentioned, this is our 2nd year. Very, very excited to continue this collaboration and just be in the presence of incredibly inspiring cardiologists and female cardiologists especially. So we are fortunate to host collaborations with organizations such as SCAI, ACC, AHA, and then we also have webinars such as Hemodynamic Basics. Was one webinar that we hosted as well. And next slide. And I will pass it on to Tasha.
Yes, thank you. In addition to the webinars, we also have an editorial board for the med students, which includes pieces, perspective pieces, as well as interview with different faculty. And you will see that we've had a wide variety over the span of 3 years of this contribution of medical students. And 2 students thus far have had the opportunity to be published in the Cardiology magazine. Next slide, please. And diversity and inclusion, going along with the vision of developing a pipeline with the American College of Cardiology and the Association of Black Cardiologists. The ACC has developed many cohorts of different students, and as medical students, we'd like to be in alignment with that. And so we've put a lot of effort this year in our D&I efforts, and that includes hosting webinars. We've also partnered with the ACC Young Scholars, and most recently, we've hosted a session at ACC 24. Next slide, please.
Thank you, Tasha. For Cardiology Industry Group program, it's considered as a network, global network program that connects 50 industry groups from different universities around the globe. So this year we recognize 50 groups from different countries, and the idea of the industry group is that students connect with each other and build a group and do different initiatives by their own at their school. So we provide recognition for them, and we provide different resources to strengthen their groups. I will pass it on to Lucy, sorry.
Thanks, Lena. The Heartbeat Herald is our medical student newsletter that provides updates to events occurring in our community and also highlights members and their accomplishments. Next slide, please. Now I will pass it on to Mariana.
Yeah, so how to join ACC. There are many benefits. You get free membership for medical students. There's free digital access to JACC journals. You can join Doc Matter, which allows you to talk to peers around the world and find mentors. You also get discounts on live courses and free online activities, and you have complete access to everything we just shared before with webinars, journal club, etc. So if you want to scan the QR code below, you can join, and you can also check the website below. Next slide. And then there's many ways to stay connected with us. We're all on Twitter, and you can check the ACC Med Student hashtag as well. You can email us, check out our website, and find us on DAC Matter. And also check out these QR codes. So with all that, I'll pass it on to Sky for our panel discussion.
Thank you. That was great. Just a lot of great work going on. I think just a lot of initiative, just wonderful research, and thanks for putting it together. And I would like members to just take a second and answer the poll while we are waiting for the poll. So I would start discussion and ask some of the panel members about, when is it, when do you decide when did you decide in pursuing a career in intervention cardiology? Is it too early to decide as a medical student to pursue interventional cardiology field? And because I think I would ask Deepti and Baski to jump in and see to share their journey, and when did they, when did you pursue the intervention cardio? When did you want to start this career?
Yeah, I can take that. I knew pretty early on when I was a first-year medical student, we had a preceptorship program. So I was paired with a cardiologist in the community. So I would shadow him in his clinic, do some rounds with him, and he would do diagnostic Cath. So that was my first introduction to cardiology. I thought I might want to do something procedural, so it seemed to offer a lot of different opportunities. So I explored that through the preceptorship program. And then when I was a third-year medical student and started my rotations during my internal medicine rotation, or rotations where I had some downtime, I would just go sneak into the Cath lab, honestly, and just shadow some of the physicians there. If I had a patient that was ACS that I was following, I would try and go in and see what they were doing. And I learned so much just from that. And I found everyone to be very welcoming to my interests. So I don't think it is too early, but I also don't think that there should be any pressure to decide early on. The path to interventional cardiology is very long. People change their mind all the time. So I think it's good to explore all your options and try and be resourceful.
Thank you.
I would agree with that. I think I was on the opposite end. I certainly did not I didn't even want to do internal medicine. So when I started medical school, I thought I wanted to go into surgery. I rotated at Shriners. I loved orthopedics. I loved plastics. And then I was like, I don't want to have my hair in a scrub cap all day. And lo and behold, here we are in a scrub cap all day. And then when I decided to switch to medicine, I was interested in GI and critical care and like a liver ICU, just really sick, acutely ill patients. So it took me a while to get to interventional. Even once I got to cardiology, I thought I wanted to do critical care cardiology. So I think a lot of different factors fell into place for me to decide to do it. But same as Dipti, I wanted to do something procedural. And after a very, very, very long training period, this was the first time where I was like, we actually get to have a little bit of instant gratification with our cases for the first time ever in our career. So I think it really is dependent on the person. I think if it's meant to be, it'll come around. But as Dipti said, definitely keep your eyes and ears open because there's so many other things. Even within cardiology, there's just so many other options. So definitely get a feel for it and test out the waters.
Thank you. I think we should be open and keep the option. But the interventional cardiology track is so specialized. Can Dr. June and Puram, can you share how do you find the niche within the interventional cardiology? Can you share what are the different tracks that's available to our medical students here?
Here, I'll give it a crack first. I'm a little bit different than both of you who have described your path. I actually knew really early on as a medical student what I wanted to do. I think I first fell in love with the vascular system during a carotid endarterectomy. I thought it was the best thing ever when they cracked open the carotid, scooped out all this calcium, and just patched it back together. And my second vascular surgery experience, they had opened up the aorta and blood shot across the room, and I was like, "Oh man, this is so great!" So that's when I really fell in love with the vascular system. For me, there's a little bit of a background in terms of why I chose to do cardiology. One of my uncles actually passed really early on when I was still in my formative years in China. And he actually died of an MI. And for that reason, I really felt passionate about cardiology as well. I wanted to combine the two of them into a passion. As it turns out, the pathway is actually through interventional cardiology and an endovascular practice. So when I actually targeted many of my research projects through vascular. I did carotid artery work with one of the vascular surgeons, Peter Henke, University of Michigan. And then I subsequently, when I started intern year, I partnered with Sahil Parikh, who's now in Colombia. But I started doing endovascular research relatively early on, even as an intern. And that has really tremendously built my knowledge in vascular management. And that's how I ended up in this space. I actually knew very early on. So within interventional cardiology itself, you can see there's actually different species of us within interventional cardiology. Endovascular are the types that would do, for example, peripheral work. So peripheral interventions in the legs, in the pulmonary arteries, DVT work, etc. So Poonam, I'll let you share some of the structural aspect as well.
Yeah, sure. Thanks, June. So my story may be very different than everybody because I started off, I had a very close connection with my maternal grandfather who was really about women's education and things like that back home. I trained in India for many years. And I really, he passed away from a diabetic foot ulcer, which was something so innocent that, we know we can treat it, but it was just ignored as a simple, some sort of a disease, just a wound, and we left it alone, and then he passed away from it. So I had a very hard time accepting the fact that with so many, people educated around, that we could let that happen to somebody who's so close to our heart. And so I wanted to get into medicine, and that was my first goal of getting into medicine. And then I started getting interested in cardiology, and the reason was I had an attending who was an EP cardiologist, and the way he split and explained the EKGs, I was so mesmerized with how do you know all that's happening in the heart with these squiggly lines? And so me and my husband were we were trained in the same programs, and both of us wanted to do EP actually initially. But then when I actually stepped into cardiology, I changed my mind. I said, I love imaging. This is so cool. You get to see all these, you do all these math calculations, this and that and all that. But when I stepped in the cath lab, that's when I knew that this is what actually excited me. This is what I love doing. And, at the end of the day, it just made me so happy despite being busy and taking call and things like that. And so that's when I really decided to do interventional cardiology. And for me, while I was on the interview trail for my interventional cardiology, actually my last interview was at Brown University with, Don Abbott, Dr. Don Abbott, who's, very well known with the interventional community. She's going to be the president of SCAI soon. She's currently the secretary. And so I met her and I instantly connected with her. Sometimes you think, oh my God, do I have to wait till the last interview to get into a spot? But that turned out to be a real life-changing for me, career changing. Everybody was great. And so that's the program I matched into. And I think, being a part of all the societies and kind of meeting all of them really helped, because she already knew me from the work I was doing, from all this stuff. And so we hit it off, and she's been excellent in actually mentoring and training me with, all the coronary work, the complex coronaries. And to my advantage, we also had Dr. Peter Sukas at Brown University, who June probably knows very well. He's a peripheral interventional cardiologist, extremely, well known and talented interventional in the peripheral field. And he let us do a lot of peripheral cases when the peripheral fellow was gone. So I did, use that 1 year, not only to do coronary and complex coronaries, but also to get my peripheral numbers, so that I was, my ultimate goal was to do something in addition to just the coronary work, because, there's so much going on in interventional cardiology. So then I decided I'd do the peripheral, get my hands on the large bore access, because it was very important for us to know which arteries and how do you deal with all that. And so that was helpful. And then I went into structural as my second year. And during that year, we also did a lot of the other, I used to jump in and help with whatever cases there were to keep my hands wet. So it's really, again, I wouldn't call my path a linear path, because every time I thought I was going into something, I actually, when I started doing something with my hands, that's when I think I changed my opinion. So I don't think it's really important that you decide, in medical school that I want to go into this and then just stick to that, because things will change. You will meet different people. And believe me, a mentor can make such a drastic change in your thoughts that you could change your path. So yes, it is important to start early, but also be flexible when you think that there's something else that interests you more than what you thought you would be going into.
Thank you. Neelima, you want to add anything?
Yeah, on the same note, I wanted to be CT surgeon, because I initially thought that's very exciting, cut open the heart and work on a beating heart. It's so exciting, right? So, during the surgery rotations, I couldn't stand long enough. I was after 2 hours, I was feeling dizzy, lightheaded, and I'm like, this is not for me. So then I switched my fields to cardiology still, but initially I was also interested in imaging, and I love calculations and echo calculations and all of that. But the passion remained to be whenever I step in cath lab, it's very exciting, and that's what I choose to be interventional cardiologist.
So with regards to the poll questions, thank you all for answering. It actually shows that only 50% of our participants are truly familiar with the interventional training pathway. So Nalima, would you mind just briefly touching on what that training pathway looks like? I think we've all alluded to the fact that there are multiple subspecialties that people can ultimately differentiate into, but as a medical student, what are they looking at?
Yeah, sure. So after 4 years of medical school, you need to do 3 years of cardiology, and that's a general cardiology fellowship. Following which you have three different paths. Either you become a interventional cardiology, or you can choose imaging, which is you are expert in coronary, the echocardiography and structural imaging. Also, you have another path, which is heart failure, and one more, which is electrophysiology. So there are four different paths from the general cardiology fellowship, which is electrophysiology, interventional cardiology, heart failure, or just imaging where you do echo and advanced imaging. Then getting into interventional cardiology, after that, you have either coronary, purely like complex coronary interventionalist, or structural, or peripheral interventionalist. So that's 2 years of fellowship training after the general cardiology. Hope
Yeah, just to clarify, that's after 3 years of internal medicine residency. So I think the vast majority of us on this panel have completed 8 years of post-medical school training.
Also wanted to add that there is the option of doing critical care cardiology, which I know is newer, but also very exciting.
And there are actually some programs out there that will transition you a little bit earlier. For example, University of Michigan, if you do cardiology fellowship there, for example, within their third year, sometimes they will start transitioning you as an interventional fellow. But essentially, it does all add up to the same number of years. There may be eventually some talk in changing the number of years for general cardiology versus subspecialty training, just to try to shorten some of the PGY years that you're dedicating for training. But right now, it's still 3 + 3 + 1 ± another 1.
So go ahead,
Sorry,
Kristen. I think I can see based on the poll, the majority, they said, so they knew they wanted to be in the IC field, like more than 50%. And I will let Christine take over. How do they choose the mentors and other remaining details?
So when we received some initial questions from the medical student community to get a sense of, where your heads are at and what your thoughts and concerns are at this point in the training pathway, the questions kind of fell into three broad categories. One was kind of, how do you even learn about such a subspecialized field when you're at such an early stage of education? The second bucket of questions were really geared toward, how do you find a mentor? Like, how do you get connected to people in this field? And then the third bucket of questions really have to do with, how do you view a career choice in the holistic context of everything else that matters in life? So things like, work-life balance, family planning, I would put into that bucket. So, switching gears a little bit away from the training pathway into how you go about exploring further some of these interests and how do you go about finding mentors. Multiple of our panelists have alluded to how important specific people were in helping them get started on their research, introducing them to various clinical environments, and how important they were ultimately in helping define their career path. So, June, I was wondering if you could give us a sense of, as a medical student who doesn't necessarily have pre-existing connections, some people may have family connections and other sort of ways that they can get connected. How would you recommend to a medical student that they go about looking for a mentor?
That's a great question. I think the best step is to look for who is doing the research at the institution that you're at. I think it's, if you have a set interest, regardless of whether or not it's in interventional cardiology, I think it's important to identify a strong research mentor. And when I say strong, it means someone who is dedicated to helping you. Actually, you want someone who will be in your corner and fight for you. It's going to take a lot of work. It actually, every step of the way, from medical school to residency to fellowship to being an attending, you may think there's actually less work with every step. There's actually more work with every single step. And all of these ladies know exactly what I'm talking about. It gets harder and harder and harder. There's more responsibility as you get older. Your children or spouses might depend on you more as you grow older as well. So it doesn't get any easier. And it's important to identify people that will be able to help you along in this process and kind of help you understand some of the ropes that you have to go through.
Yeah, thank you so much. And Poonam, you had also mentioned earlier that specific individuals played a really big role in your career pathway. Would you mind telling us a little bit more about how that played out for you?
Yeah, sure. So as I mentioned, Dr. Dawn Abbott was the program director when I was interventional cardiology. And so, she gave me opportunities to write, and I would also come up with my own ideas. And the important thing was to really deliver. If your mentor is actually spending time and giving you something that they had an opportunity to do, you have to make sure that you deliver and make sure that you stick to your deadlines, or let them know if things are not, you're getting delayed or things like that. So very good communication and really, making sure that you're going to do what you promised them to do. So she was really helpful in doing that. For me, picking a mentor was more like somebody who is really clinically strong, in addition to doing the research, because I'm more passionate about clinical work. And so it was always like somebody who I was working with clinically, I would pick them as mentors. And then in my structural fellowship, Christine Chung knows Dr. Kodali, who is also a very good operator, and he would write well. So I did write some with him. And Dr. Becky Hahn. So she's very good with writing, editing, and things like that. So, you have to just find the right person who, aligns, whose goals are also seem like they align with you. So for me, it was complex coronary and structural. And so I did pick people to write that way. And then I also thought, when I was in Columbia, you have so many people who are so talented, and Dr. Leon and Dr. Kitney and Dr. Perry, all of them were so helpful, that not only just, if you have a question and you reach out to them, you want to do something and you reach out to them, like very positive experience for me when I trained there. So I think it's not necessary to have one mentor. For me, it's been like multiple mentors across multiple programs. And that's how ACC and SCAI really help, because when you go through and meet people, I think it's up to you to actually reach out to people and keep those connections, so that when there is an opportunity, if there was nothing today, they would still have something for you at a later date if they know you're seriously dedicated and you're interested. So that's how I keep my connections. And whenever something I feel like I could work with someone, I reach out, and most people are always helpful, unless, they're pressed for time. But that's okay. You're also busy sometimes, and you may have to say no too down the lane. So it's really nice to keep those connections. And I think for me, it's multiple mentors across multiple institutions.
Thanks so much for sharing all of that. Deepthi, you had mentioned that a clinical preceptor was really important in introducing you to this entire field. For students that may be at medical schools that don't necessarily have preceptorships into really subspecialized areas, how do you think students might be able to find some of those opportunities, or what type of experience should they look for?
Yeah, thank you for the question. I think a mentor doesn't always have to be necessarily an attending. I think especially when you're a medical student or a resident, finding cardiology fellows are great mentors. As a resident, you do these overnight calls and you're working side by side with cardiology fellows sometimes, and they can be a great resource. They can get you involved into research projects that they may be involved with. They can help you learn more about the field, get you into cases sometimes. So I think a mentor, we can look at it in a broader sense too. It doesn't have to be directly a physician that you're shadowing in the clinic setting. And I think in medical school, in your rotations, that's a great opportunity for that. So if you have a program where you've got cardiology fellows, interventional cardiology fellows, I strongly encourage students to reach out to them and form that connection there.
I want to touch upon an important point. In addition to finding good mentors and everything, you have to be reliable and you have to have the accountability. Bottom line is your hard work, your accountability is very important in addition to finding a good mentor.
That's good, Nilima. I think what are the key characters or the IC programs or applicants or a mentor is looking in the medical student is reliable, hardworking. I think those are very important. And I think taking the initiative, there's a key as based on the poll, we can see there are many key factors the medical students, they're looking in when they're looking at this IC opportunity. Just wanted to go to and ask the panelists, as you can see that we already talked about the pathways and choosing the mentorship beyond and the medical students who are interested in IC and if other special challenges for women in interventional cardiology and when they're pursuing interventional cardiology or there are some concerns about radiation exposure, family planning. Can you just elaborate and share your experience, Deepthi?
Yeah, I think family planning is a huge topic that I think we need to talk more about in the fields, to be honest. If you are planning to become pregnant, I had co-fellows that were pregnant and cathing. I think there is a little bit of a myth still about whether you can practice and be pregnant and the concerns of the potential risks of radiation. It is possible, it is not a deterrent, but it is something to be mindful of. And I think on the flip side, someone who is not getting pregnant but wants to in the future, I think family planning also involves being honest with yourself about, do I want to freeze my eggs? What does that look like? When should I do it? Those are conversations that we should be having early on in medical school residency, and not necessarily waiting till you're in attending and potentially, later years.
So there's no perfect time for this. My path kind of led me in a way where my husband and I, we got married in residency, and we didn't have our children actually until we were already in fellowship. I was already a third-year general cardiology fellow with our first kid. I was actually going to add a comment when you guys mentioned your daughters were going to medical school. I was going to say that my daughter's thinking about going into kindergarten next year. So she's only 4 years old. So our second child, I actually was pregnant in my first year of being an attending. And the nurses in the cath lab joked, I literally worked until the day that I delivered. And every time any water dropped on the floor, they had thought that my water had broken. But there are ways to be safe. And I was actually doing intervention in legs. I was doing endovascular interventions throughout my entire pregnancy with Gemma. And there's actually, I had double-leaded. I had the little extra apron. There was no radiation at all actually on my internal badge every time that we checked it. So there are ways to be safe to protect yourself and to protect your kids that are developing as well. I don't know that it's necessarily a deterrent. And like I said, there's no perfect time for family planning. There's no perfect time. You just do it. There are ways to go around childcare. I'll say my parents actually contributed a lot to our first our first 2 years with our kids. They were very, very helpful. I have some of my colleagues that don't necessarily have that privilege, but they do hire nannies or au pairs to be there for them. Certainly we all know that things come up. People get sick, your kids have to stay home from daycare, etc. It's important to have a backup system and to have that support from your family members. I can go on and on about how we bickered about, which days are lab days, etc. But today is actually a day where my parents are pitching in. But usually my lab days are when we have a nanny watching our kids, so I can actually stay late if I need to. So I specifically target all of my calls on Mondays. I take all of my calls all at the same time, just so that I know there's nanny there to help.
Thank you. Thanks for sharing all the tips and how to utilize the family, friends, and how to coordinate all the challenges. Bhaski, you want to add anything?
Just to piggyback off of what Dipti was saying too, I think we don't talk enough about family planning. I don't have kids, so it's just maybe a different perspective too. But I think that medical training obviously is long. The rate of infertility is higher in all female physicians compared to general, not just cardiologists, not just interventionalists. And no one talks about egg freezing or other family planning. And the irony of it is the years that you're supposed to do it, the most fertile years, you're in training and you don't have the time off, and you also can't afford to do it unless you're coming from money. And I'll say this as someone whose family's not in medicine. I had to take loans out to freeze my eggs. And then I had to go in the morning, 6 o'clock in the morning, to get lab work done and get ultrasounds, and then run back to the lab and do cases. And I would say there was a time where after one egg retrieval, I did it as early as I could in the morning. And in the afternoon, I was back cathing patients, right? Off of my propofol. But there are so many things that I don't think have been set up, again, not just in cardiology, not just interventional. So I think that's probably a systemic change that may be a discussion for another day. But I do think it's something that should always be discussed and should be considered and should be thought about when you're a med student.
Thank you. So many challenges, and thanks for sharing the challenges and appreciate it. So I just want to ask the panelists, as you mentioned, there are a lot of challenges that we're going to face in the career. What are the strategies you have to implement to overcome some of the obstacles that you face in the cath lab? It's highly procedure oriented, highly demanding. How do you all balance? How did you face the obstacles?
Sorry, go ahead, Nilima.
Yeah, go ahead, Dipti.
I was going to say it's a marathon, not a sprint, right? It's easy when you're in training. You've got 3 years of this, 3 years of that, 1 year of this, and then I'm done. And then you get into attending life and you realize, oh, I just started. And it's now harder. I'm working more. And, there's all these other adult things to consider, right? For me, I realized my first year, I just was trying to figure out how to be an attending. And my second year, I realized, okay, I need to incorporate balance. Balance here is obviously not the same as it would be if you were not in interventional cardiology, but I think we still need to try to create some kind of balance. I am the expert of the 5-day international trip. I will use whatever time I have to go somewhere, because if you tell yourself, eventually when I get 2 weeks off or 3 weeks off, or when this is okay or that is okay, that time just doesn't happen. So I think we just have to be more intentional to create balance, because we still want to enjoy life outside of this field that we love, that we dedicated so much time to, but we still have other interests and identities.
Yeah, there is no perfect time. I would like to add that there is no perfect time. What works for you may not work for others. So if you have good family support and if you have enough friends and family around you, you can do it anytime. It doesn't matter. And regarding the cath lab exposure and getting pregnant, I was pregnant in my first year cardiology fellowship. The way I did it is I took all the calls ahead of time along with the cath lab rotations ahead of time, and then planned for my pregnancy later. So you can adjust the calls if you are very worried. If not, then the cath lab technicians also get pregnant. So there is a way to work around it. It's not a big hassle if you have a family support, I would say.
I do want to bring up a question that was entered into the chat from the audience. The question is, once a medical student does have an opportunity to shadow in a cath lab, what is the best way to make this a productive and fruitful experience? Is there anything in particular that they should focus on getting out of that shadowing experience?
I would say being the closest to a medical student. I think the important thing is if there's an interesting procedure, an interesting patient, or something you hear about, go home and read about it. Because I feel even now as a new attending, if there is something that I see in the lab that I haven't seen before, or that is just extremely different for me or really rare, I go home and I literally read about the hemodynamics of it. I'll do it again, just to kind of refresh. And then I try to explain it to somebody. And then see, they always say if you can't explain it to a 5-year-old, you probably don't understand it. So I think reading is going to be your best friend here, personally, at least at the early stages.
I totally agree. I think being prepared as a medical student, at least be knowledgeable, the basics, and then if you see an interesting case, take the initiative and talk to the attending and say, is it okay to write? Or is it interesting? Can I do a review article? Can I do a combine few cases together? Can I do a prospective study as a transradial, transfemoral complication? There's so many things that goes on in the cath lab. I think just taking that initiative is very important for the students.
Yeah, as I said, like being proactive and show your commitment to it and be proactive, show your interest, then attendings feel interested in you to teach more and more. Yeah, if you shy away from it, nobody feels like you are interested. So show your interest and show your commitment.
So with regards to the second and third poll questions, the purpose of it was to try to understand from the perspective of a med student as they're considering all the different factors that impact our choice of a career, how they view the different factors that make interventional cardiology a specific career choice as opposed to something else within medicine. I apologize for not anticipating that in the context of a poll like this, it is very hard to do things that are in rank order. And so rather than trying to kind of classify these, I guess I would love to just open it up in these last few minutes to our medical students that are on this webinar. When you think about things like the flexibility of a schedule versus having stable work hours, the ability to have perhaps a career that is more geared toward instant gratification, doing something with your hands, seeing an immediate result. When you think about financial benefits and pay and how to, sort of weigh that against the medical student debt that a lot of us graduate with, what are the factors that are most, rising to the surface as you consider a career in interventional cardiology? I'll just open that up to Adriana or Mariana, Tasha, any of you, please feel free to chime in.
Dr. Chung, sorry, I didn't think that this question was going to be towards the med students. Do you mind saying that one more time?
Yeah, no, absolutely. I think, with regards to us being able to best mentor and help provide guidance towards students at your level of training, it would be great to understand, what are the factors related to choosing a career, things like stable hours, having a flexible work schedule, having pay that's in a certain range, having the ability to work with your hands, working with patients that are more potentially critically ill, like high acuity care, as opposed to fields that are more geared toward less acute outpatient care. How do you weigh those relative factors? What seems most important at this stage? What is drawing you toward interventional cardiology as opposed to maybe detracting you away from it? That would be helpful for us to understand.
I'll just briefly say some of the factors that just come to my mind because they always do when I talk about interventional cardiology. Is the hands-on and the adrenaline of being inside the cath lab specifically. I don't know, I've been really attracted to coronary, structural, and adult congenital procedures. So I'll just leave it as that. The adrenaline and the fact that there's so much creativity that goes on into intervening, and especially on adult congenital procedures, because it might just be one of a kind case, and then it's in your hands to figure it out on the spot. And I feel like that's the adrenaline that I feel very attracted to. I will leave it, I'll pass it on to my other colleagues for them to chime in.
Guess, yeah, just to add on to Adriana's point, I think in addition to the hands-on nature of the field, I think just the space for innovation as well. Just seeing all of the new devices that are coming on the market, the new techniques, the new methods, the new spaces for collaborations with not just fellow cardiologists, but vascular surgeons, cardiothoracic surgeons. I think that space for innovation is also really, really attractive. And I would love to hear your thoughts on how you kind of engage in innovation, engage in kind of staying up to date with the field that is constantly changing and expanding.
Yeah, that's an excellent question. I am aware of the fact that we're kind of running up against the end of our time. So I do just want to mention that often there are opportunities to work directly with industry, to have sort of back and forth conversation about what improvements you would like to see in their devices that would help you better treat patients. And so there are opportunities even for those of us that don't have an engineering bent or necessarily want to be an entrepreneur and start our own company, that you can still work with existing companies to try to influence the way that they develop their products. So in these last couple minutes, I just want to thank all of our panelists as well as our medical student representatives. Thank you so much for taking the time to share your perspectives. In particular, thank you to the medical students for really showcasing the tremendous work that you're doing. And the initiative that you're taking to really develop a content expertise way before I think I'll just say for myself, before I was in a position to do that kind of in-depth work. Thank you for sharing the opportunities for other medical students to get involved, so that they're aware of the resources that are out there. I also just want to request if you could please fill out this last poll just so that we know how useful it was for you. And if you do have any comments about the topics and specific content areas that you would like to see addressed in future webinars, that would be very helpful for us. And with that, I will just thank everybody and wish you a good night.
Thank you. Thanks everybody for joining, and thank you for your time.
Thank you, everyone.
Thank you.
Thanks.